G'day, mate, and welcome back to Project Hospital with me, JD. So we're here, we're starting. If you watched last episode, good on you. I don't know how you bore through it. Basically, I hired lots and lots and lots and lots of doctors. Events, crash, epidemic, natural disaster. Oh, they sound like fun buttons we need to click. But what we'll actually do before we click any buttons is we're going to this is just all insurance agencies can be contacted. So we're going to close those. We're going to have a look at our money. So we have 0 patients. 6 patients, but none of them actually got here yet. We've spent $50,000. Doesn't look like it was actually hiring anybody. It looks like it was just in the re-roll button to try and find staff that we need to run these departments. We have no ambulances. I don't know why. Can't we build an ambulance? Actually, I think we can. Yep. Ambulances can only... Oh. Okay, I need money before I can build an ambulance. Let's hope ambulances are cheap. Turns out they're not. They're like $35,000. Yeah. But we need an ambulance, it turns out. So, we've got an ambulance now. I hope it really comes with like drivers and people. Can I get a refund if I put it back? Okay. We have to treat... This is all our insurance objectives. So treat 10 patients a day, 1 patient, 1 patient, 1 patient, 1 patient, 1 patient. On top of that, we're hoping to repay all our money we just borrowed. We have a crap ton of staff. All employees. That seems really short. Oh, this is just for this department. Oh, wow. Okay, because everything's departmentalized. Oh, alright. We're going to unpause. We're going to see what happens in the chaos. I currently have, is that right, 60 patients coming? Untreated patients. So all the night staff are going home. Day staff are already here. Patients are walking in ever so slowly. So they're going to come in from there, in through this main door, and probably in through ER. Even though they shouldn't. You know, patients will be patients. Maybe they're not going to come through ER. Insurance company Cheapo Care can be contracted to send patients. Sure, send more patients. Build and hire staff for 1 stat lab. I've already done that. Hey, 20 grand government grant. Build an x-ray room. Another 20 grand government grant, I hope. Now I got 5 grand, so I got some money. Treat 1 patient. Neurology. I've already got neurology. 20 grand government grant. Well, I should go repay my loans, but... Ambulance! More grant. We're going to get money left, right, and center. It means we're actually curing people. Oh, no. See, JD spoke too soon. Patient collapsing. Staff will do everything they can to keep them alive. Oh, you haven't done anything with him. He's literally just arrived. Okay. Pause. Where is said patient? Let's remove the walls. He's dead on the ground. So... He's... Alright, so he's got either salmonella, which sounds really, really bad, Turamilla. Mainly affects the skin, eyes, lymph nodes, or lungs, caused by blah bacteria, highly contagious, potentially fatal, and can be treated effectively. Or typhoid fever. Oh, not to be confused. Oh, typhus fever. Typhus is caused by bacteria transmitted through various types of fleas. Okay, alright, so it is different. Alright, so we're going to do chest, temperature, blood draw, oral, micro, physical, trauma center. Yeah, we don't need to move into ICU yet. We've seen to in trauma. Rehydration. That's a good start. Ortho. I can actually pay back some of this money. Go away. I treat 10 patients a day. Boom, more money. Oh, wow, anyway, I can really pay back this money. Come on, what's happening? It's been hours. He's now awake, so we could actually... Oh, he's not awake. Not available. Patients can't talk. Sure. Let's go in for everything then. More grant money. Pay back more loans. So, if I've got a fully functional hospital, the answer is, I can make a fortune, right? Patient's collapsing. It's another one. Okay. Where's my other collapsing patient? I will deal with the critical ones. That sounds like the way to go. Thin membrane sac surrounding the heart is inflamed or growth. What? Okay. So let's go with physical. Then we're going to do a chest. And controlled by me. And... Oh, okay. TC hospitalization. Alright, that's... Somebody's mopping literally right on top of the dude. You can stay beside the other sick guy. Defibrillation. Oh, damn. Hey, he's back alive. Oh, we're making lots of money. So, he's got a fever. We're making money hand over fist. So, why? We'll try... We will try a temperature measure. Like, it already says fever. So I don't know why... Swelling limbs. Well, it's that one. Okay. Pause, slow down game. Slow down game. Yeah, I finished diagnose it too. IV something something. Go away, notifications. Okay. So... Any office ward unit. So we just need you to do this. Regular hospitalization? Can I move you to a different ward? I don't really... If they're finished... And that's active right now. You're not getting any better. None of these have helped. IV costonics, yeah. Well, I don't... How do I... The patient is waiting for you to plan another treatment or send them home. They're all planned. They're all done. IV infusion. Airway resistance. That won't help. Lower the temperature due to fever. Well... Okay, so we're going to try that one. Inflammatory cream. Cough suppressants won't help. Okay, maybe that... Because, like, technically he's cured. I don't understand why he just doesn't get kicked out. How do... Oop. Wrong one. I want to look at this one. This one? So we only treat, like, 157 staff. We only treated 28 patients a day. That's not good. Oh, you got... You're one of my patients. Why are you taking so long to be treated? I'm curious. Go away. Go away. It's only got a 40-odd %, 40 workload. We'll put on another orderly. We will hire another doctor for the fun of it. See if that helps. Either it's waiting... Is he waiting on... Stat lab? Stat lab. So he's waiting on... stuff from the stat lab, which does not run at night. So we need biochemistry, biochemistry. We want the stat lab to run results overnight as well. Alright, game speed 3, go. Okay. I'll click OK. Where are you? Pause. Long wait. No. Daniel Davis. You have typhus, which needs antibiotics. Okay. And then we'll put you on control by doctor. Pin. Rename. Alright, player control. Patient is collapsing. Go to. You're my new patient. Rat bite fever. Rat bite fever is an acute febrile disease caused by bacteria transmitted by rodents, particularly by their urine or mucus secretions. Ew. You need antibiotics, obviously. Heart failure. Defibrillator. I thought there was one that fixed heart rate. No. Alright, so we're going to do a defibrillator. Is it the same patient or a different patient? It's a different patient. Doctors, what are you doing? Cardiovascular surgery. Active treatments. You're waiting to be transferred? Hospitalize the patient at a high dependency unit. And you currently got heart failure. Well, I'm going to go with defibrillation. Somebody come defibrillate him. Yep, zap. Heart failure over. We don't need any more diagnosis. Alright, what's our... Is it this department? Hang on. We were in... cardio. We have a HDU. Where is HDU? HDU is... here. Oh wow. Oh, this is nighttime. No, even daytime. I didn't bother hiring these. No, I did hire these staff. Cardiotech. Fire? It still says 0. They're doctors, they're nurses. These are the only 2 tech positions. Sonograph unit. Which is a USG. Yeah, that doesn't make any sense whatsoever. You're wrong, game. You're wrong. Alright. Back to our crashing patient. I think he's waiting to be transferred to ICU. Pause. My player control. Palpitations. So far... Oh. So far, it's been zapped them, but we don't have a zappy machine anywhere here. Why don't we have a zappy machine anywhere here? This room. Defibrillator. Let's put a zappy machine on the wall. Can I zap you now? Okay, stop. I want to scroll. Finish, send them home. See, all these aren't finished. Breathing problems. Okay, we'll give you this. Irritable cough, that'll fix that as well. We'll give you that. Swelling limbs. Anti-inflammatory cream. Am I meant to cure everything? Your patient is collapsing. Irregular heart rate again. So, have those for your headache. Have those for your fever. Have that to stop you vomiting. Have inflammatory and relief pain. Sure. Rest. Rest won't really help with any of these. Heart failure for a second time is definitely a good sign. That's definitely a good sign that something's gone wrong twice. Maybe this will fix him if I just dose him with everything. Employee got drunk tonight. Won't feel too good today. Excellent. Treat at least 70%. Oh, wow. We got like a few bonuses. Employee got fired? Okay. Michael's screwed. He's going up to ICU. Close that. There was a way. I saw an employee got fired. Patient died. Ugh. It still says he's got an irregular heartbeat. Are you sure he's dead? It says dead. But I do wonder. Okay. Patient is collapsing. We've done all those things. Use to relieve pain. Sure. There's one hidden symptom, but I don't know what the hidden symptom is. Bronchial meds. Inflammation. Go for it. Hospitalized. Sleeping. Bed required for examination. CT is occupied. Okay, where's CT? You're in that department. That department doesn't have a CT. That department. You don't have a CT. You have a CT. Just don't know where the hell it is. CT room. It's because it does not have anybody running it at night. That would be the most common answer. Why are you waiting such a long time? Back to there. Was it you who was waiting for a CT? Yes. We'll add you to our list of collapsing patient. Excellent. This is one of my patients. We've set you up for surgery. I can't even transfer you. Pain. Bronchial pain. Rest. See what happens. See what happens. See if our patients survive. Scheduled procedures. Last was urgent echo. Patients waiting for you for another treatment. Like, as far as I know, you're treated. So you're getting oxygen. Oh. Oh. Abnormal rhythm of the heart. Do you have an abnormal rhythm of the heart? Tachycardia. You do. Have some of them too. Oh, I just gave you tachycardia meds. Like, now that that's suppressed, are you ready to go home? Or can you please be patient? Your favorite patient. Okay. Irritable bowel syndrome. Irritable bowel syndrome means diet modification. Have some diet modification. Have some vitamin supplement. Controlled by me. Go. You're this one. No. Go away. Go away. Go away. You're here. Okay. You're all done. Like, why are you here? Oh, diet modification. Okay. Go away. Okay. But required. Where are you? Okay, you're in emergency. And it is nighttime. And you wonder why you're waiting a while. You're waiting for X-ray room, which is up here. X-ray room, that one. Which does not have anybody running at night. Which would probably be why the queue is so long. Okay, now that's fixed. We'll even throw in a janitor. Now we'll come back to game time. We'll click on you. We'll click on follow. We'll click on that. Diet modification. Chest injury. No. Wheezing. No. Regular hospitalization. I can't see anything I can do with you. All these have been prescribed. Oh, HCU. Oh, you're in high dependency already. Hospitalized, sleeping. Hospitalized, checked by a nurse, sleeping. I can't see anything I can do with you. You seem to be fine. You seem to be ready to go. Fertility of the intestines. Abnormal animation connection between two hollow spaces. That means nothing to me. Apart from abdominal surgery. So you need to go to surgery, abdominal surgery. Boom, boom. You're done. You're done. That's quick and easy. We just send you off for surgery. We'll give you some anti-diarrheas as well. Like just you're having surgery will fix your diarrhea, not a problem. Like a nurse is going to clean it up anyway. Just let it go. You're still flashing and not happy with me. Control payment was true. Now we're going to go home. Release. Go away. Patient got worse because a wrong diagnosis was treated. Oh, excellent. Are you one of mine? I don't think so. So you have bacterial infection or appendicitis or bowel disease. So we're going to give you microbe sampling. Going to give you one of those as well. We'll give you one of those. We'll give you one of those. We'll give you that to bring down your fever. And then we'll run. We'll see what happens. We will see what happens. Patient is collapsing. Palpitations. Give them give them an interview because we have no idea what's wrong with them. Give them TC hospitalization, IV, and save her, save her, save her. That's a good start. Shove the IV in there. No, I'd really like you to do an interview. Please. Vomiting. Okay, so we're going to give you those to... Okay, we're going to give you those to fix that. You've got dizziness and vomiting. We'll give you physical. We'll give you a... Did you... Oh. Like, I don't want the doctor to try. The whole point is I'm trying. Yeah, I'm already doing that one. Oh, that one. Which is IV antibiotics. Which I can't select. Hospitalisation required for treatment is not available. You can try changing the department. Okay, so we're going to go with that one. IV antibiotics. I really don't even want that department. That department? Sure. Get rid of that. That'll get rid of that. We'll give you some recommendations as well. No. Inflammatory? No, we don't really have an inflammatory. Okay. Aren't you done? You're done. There's nothing wrong with you. Suppressed. There, we're just waiting on your surgery. Like, surgery faster. There's nothing I can do about that. But anyway, this has been an interesting first episode. We've made a shit ton of money, believe it or not. I have no idea how. And actually, let's go to... Let's hit that. Let's hit... Oh. Pause. You're done. You can go home. Who was the patient before you? That was the patient before you. Alright, we just need to stop here for a minute. So, where... I want the graph. We're treating 93% of patients correctly. It doesn't tell me how many died. No, dead patients, 0. There you go. So, we're doing actually an alright job. You know, Dr. JD knows what he's doing, believe it or not. Anyway, I'm going to leave it here. Thank you guys for watching. Do hope you enjoyed, and I will catch up with you in the next one. Alright, bye.